Hello, everyone. My name is Caitlin Long, and I am a PhD Fellow of Health Research and Innovation at Alvernia University's OPAKE Institute for Economic Development and Entrepreneurship. I'm studying for my PhD in Leadership, corporate track at Alvernia University. I am a physician assistant by trade with a clinical background and do run my own small business, Team Lifelong Wellness. Great to meet you all. Very excited to be presenting here at the International Health and Wellness Society Conference. And I'm going to speak with you all today about burnout to balance, particularly in high achievers. Sharing our slide deck today. I will be presenting a proposed mixed method study. All right, so an introduction on burnout. If you're not familiar with burnout, I would be very surprised as burnout is present in every major journal article, every magazine, every blog post, LinkedIn, no matter where you're looking, burnout is a hot topic in today's world. Burnout is now an issue of epidemic proportions worldwide. It is actually recognized as a syndrome by the ICD-10 criteria for clinicians. And now we're seeing more and more burnout on the rise due to the effects of the COVID-19 pandemic and a phenomenon called the Great Resignation. And we are seeing high achievers and leaders also burning out, not just the general workforce. So I started to want to ask some questions around that. So my research questions as I am going through my studies in my leadership degree were, how does the severity of burnout measure in these high performing, high achievers? Is there a relationship between these high achievers and burnout? Are they experiencing it more quantitatively? And how does burnout affect the high performing, high achievers and leaders of our institutes? So what kind of influencing factors or experiences are they having? What different insights can they provide? And is there a lead on prevention and recovery in burnout? And lastly, can a pilot wellness workshop improve burnout in these high achievers? So the framework, of course, for burnout, as most burnout researchers would know, that Freudenberger was the first to describe burnout in the 1970s, and he studied that in mental health population. Later on, elaborated on by Christina Maslach in the 80s and 90s and well into the 2000s. Burnout is described as three criteria: depersonalization, emotional exhaustion, so beyond that physical fatigue. And number three would be the decreased sense of personal accomplishment. So obviously a very serious issue. So this again describes the framework from Leiter and Maslach in 2003, 2004, that is showing the interrelation between areas of work life, so what I would call balanced life, and burnout, and those three criteria. So there's the different definitions here, but I think it's really important to see how our values can play into those criteria. So why do we care about organizational wellness and decreasing stress and burnout anyway? So for individuals, we want to decrease stress and overwhelm to increase productivity, time management, improving job satisfaction, employee engagement. We want to increase self-efficacy, confidence, and everyone's sense of personal accomplishment. We want to improve overall well-being, work-life balance, and quality of life, have an improved sense of control, and long-term effects of burnout can be very concerning, such as insomnia, anxiety, depression, suicidality, substance abuse, familial and relational dysfunction. As far as organizational wellness, we would love to improve our overall organizational productivity, performance, job satisfaction, employee engagement, and promote a positive work environment. When we see less turnover and less unexpected callouts or time off, we see improved employee retention. We want to be able to synchronize the personal and professional vision, mission, values, and purpose of our organizations together. And of course, there's better financial implications. There are healthcare costs of burnout up to 125 billion to 190 billion annually. And of course, there's a potential for decreasing insurance premiums when employee wellness programming is implemented. So lots of value proposition there. So as far as methodology, I'm proposing a mixed method study. Now, this is still in progress and potentially will be related to my dissertation work. So wanted to gauge it here at this conference and explain some of the framework that I am studying early on in my PhD career. So looking at a potential explanatory sequential core design as described by Creswell and Plano-Clark. So looking first at quantitative data with the Maslach burnout inventory and also her areas of work life survey. I've obtained the licenses to those surveys to be able to distribute those in Qualtrics. So utilizing those questions first, and then being able to take the Likert scale data and organize that in a fashion that I could obtain quantitative results from. Then I would love to explain the quantitative data by qualitative collection and analysis through semi-structured interviews and really understanding the lived experiences of these high achievers going through burnout. And then finally coming to an interpretation. So for the initial sample, I'm looking at a proxy for high achievers, which would be leaders at one university high performing department. I'm looking at student leaders who are in honors programs, come highly recommended from their professors, might be serving as student athletes or student workers that are highly involved. I'm looking at doing a pilot program with this proxy with the high achieving, high performing leaders. So the delivery modality would be in hybrid format, a 6-week program utilizing synchronous and independent asynchronous and self-paced workshop and modules. It would provide education around stress, burnout, and overwhelm, and exposure to practical tools and training to build resilience and combat burnout. It would also provide coaching and accountability. Data collection. So of course, online survey on Qualtrics, which is the platform that Alvernia University uses for our survey collection. I would utilize validated tools, of course, such as Maslach's burnout inventory and areas of work life survey. And then the collection would happen at the start of the workshop as well as its completion to be able to compare the scores. This is just a sample of Maslach's burnout inventory and what the questions may look like. Again, showing that Likert scale. One example, I feel emotionally drained from my work. The answers range from never to every day. Again, moving on to the areas of work-life survey. Some questions will revolve around workload, control, reward, community, fairness, and values. So that goes back to that graphic that I had described in the beginning of the interrelation between the elements of burnout and the areas of work life. The qualitative addition, I think, would add a lot of value to this study. And this is the ongoing piece that we're looking at semi-structured interviews that would eventually be coded with specialized software such as NVivo, et cetera. Results and discussion. So preliminary results are showing that high-performing high achievers do experience high levels of burnout and decreased levels of area of work-life balance. Post-pilot, we are seeing a trend towards an inverse relationship to that the pilot was helping with their burnout levels as well as work-life balance. But we would need to compare to the rest of the population as a control to see if the baseline levels of burnout and work life would be the same. And after the 6-week period, would that differ? Other outcomes and metrics. So this pilot was run, an earlier version, a prototype, in a private and corporate community setting with a group of adult professionals. And this was a wide range of occupations, social services, healthcare, education, and students, which did demonstrate a positive effect on burnout and areas of work life. The respondents at that time reported feeling less critical or cynical, improved sleep, decreased feelings of dread around work, improved control, improved positive mindset and attitude, feeling more present, and reduced overall burnout. Conclusions so far, the preliminary findings in the community setting and the university pilot, coupled with the literature review and existing research, are suggesting that this intervention may have a positive effect for individuals and at the organizational level. Empirical evidence suggests that the wellness workshop or intervention, as designed, may have an impact or effect on reducing burnout and the associated negative and individual and organizational implications. High performing individuals and organizations may benefit from such programming, and the study appears successful in achieving its intended outcomes. Next steps for this study, I believe that this would also add value if this were in an iterative manner, looking at more of a longitudinal study of burnout, because in a 6-week snippet, it's really hard to make those conclusions about their long-term relationship with burnout in areas of work life. So I would like to study this further. I would like to add in the leadership piece. So looking at the variable of different types of leadership, different styles, likely using the MLQ to assess for different types of leadership and if burnout affects different types differently. And I would look at a different focus group of leaders potentially outside of the university setting. I do feel that this could inform employee wellness workshops and trainings, quality improvement initiatives, recruitment and retention efforts going forward. More to come. So thank you very much for tuning into my presentation on burnout to balance and high achievers and the proposed mixed methods study. I would like to take any questions at this time. Please type them in the comments, and I look forward to connecting with you throughout the conference. I would like to give a special thank you to Alvernia University, as well as the Opaque Institute, for helping me with this research and all of their mentorship and support. Thank you very much and have a great day.